Thank you very much, Mr. Japneet, for a warm welcome and a very nice introduction. Hello, everyone. Good evening from here in India. And hello to all the audiences and Dr. Tulika Shukla as well. I'll just share my screen and then we'll start with the screen. 1 second. So I hope you all can see my slides.
Perfectly visible, doctor. Carry on.
Right. Can I begin now?
Yes, doctor.
Right. Okay. Right. So thank you, Zivanza, again. At the outset, I would like to thank Zivanza for organizing this wonderful awareness session, particularly talking about childhood mental health problems, which we don't usually talk about. This is one area where there's still a lot of awareness need to be raised, and people need to really come forward to start recognizing childhood mental health problems. Even doctors ourselves, sometimes we may be quite ignorant about recognizing these childhood problems as part of their mental health problems. So this session really is about giving you all an idea about how to recognize childhood mental health problems and what to do about it and where to seek help. And my colleague, Dr. Tulika, will be following talking about parenting skills, protective and positive parenting, which blends well with the introduction I'm going to give. Right. Now, once we all know the childhood is very beautiful, right? Until you become parents, you start realizing that it's not all that fun. Every parent would expect that their children's childhood be a perfect and problem-free, but that's not always the case. We do come across a lot of challenges. As much as fun we have raising our kids, we still see a lot of problems we need to deal with. I think through the experiences, we do learn to manage them, the various aspects of their emotions, the behavior, the learning, the cognition, the social aspect, and so on. However, in some cases, it can really cross some line, that optimal acceptable line, and children too can encounter psychological problems. The whole idea of this session today is to really get a little more insight and awareness about childhood problems, psychological problems. So what I'm going to focus on in this first half of the talk today is becoming a little more aware about childhood mental health problems, identifying how to recognize those initial signs, and the earlier we identify, the better it is, so that we can intervene early and prevent the damages and the negative consequences. And where to get help from? What do we do? Right? It's not always that we need to run to the specialists. Many things we can do ourselves. And Dr. Tulika is also going to talk about a lot about the parenting skills as well, which will be very useful. And how do we empower our children and empower ourselves? It's all about identifying, accepting, adapting, and see whatever we can do within our limitations, and at the same time trying to look at things in a little holistic way and see if we can get help outside just whatever we can do as a family. And then the question is, why should I know? My kids are absolutely fine. We all want to be in that denial, right? Why should I even know? Even everything is absolutely fine. So I would want to know only when there is a problem. But here the challenge is, what we are really focusing on is, do we even know what the problem could be? Right? A lot of things we may recognize it as normal or slightly deviated from normal. For example, a little overactive child, we may see it as just a little naughty kid. I'm sure he'll get over. In most cases, we may be right as well. I'm not saying we are wrong, but those little things we may miss, and a little later we may realize that it could be part of a bigger problem. So we all know that there's no health without mental health. I think this, I don't need to stress too much on the importance of mental health, particularly following the pandemic. We're already seeing a lot of mental health crisis following the pandemic in various ways, including children. I certainly in India see a lot of children going through a lot of emotional issues, behavioral issues, addiction to gadgets, self-harms, and so on. So yes, there are deeper issues the children are dealing with, which we need to explore and address. So mental health, having a mental well-being of a child is extremely important, not just for their cognitive development, for their overall social, behavioral, and even forming healthy relationship with other people. And also, kind of developing the resilience to deal with the adversities and any specific traumas. And it's important that we understand the child. We all think that we do know our children, but we know the problems they might be going through. As children grow older and older, they may not be easily expressing things to you. So it's important that we become aware about the problems they might be encountering and the impact. So it's the most important thing. It's not just about presence of some behavioral problems or symptoms, it's also the impact that could have on the individual and all the collateral damage it can cause to families, the society at large. So like I said before, early identification and intervention, definitely helps in preventing a lot of damages, and it also helps us in kind of planning a collaborative approach in terms of how can we help the child with involved in the family or even sometimes in the teacher, the doctors, and many times specialists as well, like I said, to prevent any serious consequences. So what are the main issues of concern as parents? Usually parents or even teachers may have specific concerns about child's development. It usually is about some kind of behavioral issue, that children could be a little overactive, little, getting a little angry, irritable, or there may be emotional issues. The child is becoming very moody, sometimes very anxious, or socially inept, or sometimes there are issues with learning, right? The child may not be doing well academically, or specific subjects or specific aspects of learning as well. Many times, as they grow older and older, maybe little, when they reach the adolescent age, a lot of lifestyle issues parents get concerned about. Maybe their sleep timings, the simple things like the sleep patterns or eating habits or sometimes mobile usage, the kind of people they hang out with, many times serious problems like, addiction, getting addicted to some substances, and also a lot of developmental issues. As a child, is born, and as it grows, they acquire a lot of skills at different pace and at different times. Every child is different. Many a times as parents, we may not even realize there are some, kind of maybe impairments in the development or some delays in their growth, not just the motor, that their emotional or the cognitive, social, behavioral aspects and all that. So it's important that we become aware. So these are the usual areas of concerns that any parent can have about their children. But there are challenges as well. Yeah, let's highlight the challenges before we actually try and understand the actual problems the child may face. Look, how do we know whatever problems we identify in a child, is it normal or abnormal? Please understand, normality is something evolving. Like I said, every child is different, every family is different. There are aspects of cultural, the religious, and the various aspects that we need to take into account. So, for example, a particular behavior of a child, which could be deemed as completely normal in certain cultural context or a familial concept, it could be deemed as abnormal in other culture. So, we need to take a larger context and understand things in a little holistic way. So, the concern or the behavior the child is presenting with, is it adaptive or maladaptive? So, when I say adaptive, is it the response of a child to some kind of crisis that a child is facing? Maybe there's larger issues in family like parental disharmony, a very kind of disruptive family. Maybe the parents are having mental health issues or some addiction issues, or some kind of antisocial issues going on in the neighborhood or whatever. Is the child behavior adaptive to those things, or is it maladaptive? And how do we look at this problem? Do we look at it like an individual or a systemic issue? Is the problem pertaining to the child alone, or is it to do with the system around the child? So many times we know that the child could be a reflection of parenting skills as well. So we really need to have a larger assessment with the family, and maybe talk to the teachers, and maybe even observing the child at school as well, to understand that this could be a systemic issue. So it's important we look at every child's issue as a systemic issue. So the problem the child is presenting with, is it transient? Is it in response to some crisis? Is it only lasting for a few hours or few days? Or is it situational? Is it only pertaining to some situation? The rest of the situation, the child is absolutely fine. So these are the key questions we need to address. Some of the other challenges could be ignorance, like I talked about at the outset. We all may be ignorant about identifying the abnormality of the child's growth, emotions, cognition, behavior, and all that. Of course, we are still in a lot of denial, and there's a lot of stigma about accepting if there are any mental health issues with the child. So, look, we need to understand that the science has moved far now. Early identification, there's a lot of things we can do to help the child and the family. Many times you have to get back to the normal track, and many times making some adaptations and trying understanding what are the strengths of the child and helping the child to move in that direction. And a lot of challenges is also about lack of help, lack of structured help. We may identify the problem. There are how much access do we have to the structured help. In an ideal world, we probably need a multidisciplinary team to help the child and the family, a team of psychiatrists or psychologists, an occupational therapist, a speech therapist, a special educator, and so on. So do we have access to all of it? So all these things are little challenges we may face when we identify childhood problems, and many times coexistence of multiple issues the child may have, like physical health issues, the familial issues, and so on. Now, let's take a minute to look at the consequences of mental health challenges in children if not addressed in time. It often leads to poor academic achievement. That's one thing a lot of parents would be concerned about. That if we don't address, like let's say a child going through attention deficit hyperactivity disorder, so it could potentially lead to poor academic achievement because of child's cognitive issues. Can develop into serious mental health problems like personality disorders, or many a times the substance misuse, or children may develop other serious mental illness like mood disorders or even psychosis, and all that. And the consequences on the individual, the interpersonal relationship they're going to form eventually, and the family at large, social consequences. So all the other consequences we need to be aware. And we know that mental health disorders are leading cause of disability in the world. And there are also a lot of increasing suicides, and self-harms in young people, particularly adolescents. And it also leads to a lot of criminal justice system problems. A lot of children, may get into a lot of criminality and behavioral issues when they actually grow up. So because of many developmental issues they may be facing, which was maybe unidentified and addressed when they were children. So let's try and understand before we actually start talking about the actual mental disorders and the symptoms of mental disorders, the needs of a child and the causes of mental disorders. So this is the Maslow's hierarchy of needs. Many of you may be aware. So it's important that all of us become aware about what are those needs of the children. So if you look at this pyramid, let's start from the bottom of the pyramid, the basic needs of the child. So the basic needs for all of us as human beings is the food, water, shelter, sleep, and air to breathe. So that's our basic. When that is satisfied, when we are okay with that, then we probably keen on developing those safety needs, the secure and safe attachments, wanting to be in a safe environment and protected from any kind of harm. Then the social needs. Once we are satisfied with our own safety and security, what we want is have some love and compassion for others. We start becoming empathizing with others and trying understanding others' emotions, the feeling belonging, and being integrated into a social group. Then if that is satisfied, we all move into the esteem needs where we start developing strong positive self-image of ourselves, and some genuine self-esteem, having belief in yourself and that you can make it, and the self-confidence, the self-worth, all those things get fulfilled. Then you reach the next stage of self-actualization. That's where you really open your arms to the world. You become very creative, having fun with life. It's the tip of the pyramid where you're yourself, you've been very genuine, and you find the real meaning of life. So depending on what stage of this pyramid the child is, we need to work around that. If the needs are not satisfied, there's no point in talking about the social belonging next, for example, or the self-esteem in the child. So we need to always bear this in mind, and so that we can help the child in a very structured way. And the ideal fiction, look, we all need to understand that all our thinking, feelings, and behavior has to be in some kind of equilibrium. We need to have, this is called an ideal fiction, where everything seems to be balanced. But that's not always the case, right? We all get into a lot of disorders in the way we think. One day I may be happy, the following day I could be getting into a lot of negative thinking about myself or future, things like that. And again, the emotions also play up differently. And when these two things get affected, obviously it reflects on our behavior, in how we deal with things to ourselves and how we deal with things in our environment as well. So let's try and understand how does a mental disorder, what happens to this equilibrium, in a child, and how does it actually develop, some dysfunctional traits, for example. So we all heard about this nature and nurture. So the nature are the genes we carry from our families, and all the experiences we've been through all our life, right? Both of these things in combination, it contributes to development of some of the core beliefs and assumptions we develop. We all get into some ways of functioning, some way of perception. we call them personality traits, the way we deal with things. It's based on those two things, the genes and the experience. But what happens whenever there are triggers and stresses in life, these assumptions and beliefs get interfered, and then it starts affecting the way we think, feel, and behavior. So what we saw in the previous slide, the equilibrium gets affected, and we may get into a dysfunctional cycle of negative thoughts, feelings, and behavior. So it's important to understand the nature and the nurture of a child when the child develops some kind of mental health dysfunction in their thinking, feeling, and behavior. Really get to the bottom of things so that we can help them in a very structured way. And there's also this another model which explains a little bit about why some people could be more vulnerable for mental disorders, the stress vulnerability model. So as you can see in this slide, there are two cups at the bottom of this slide which are of same size. When both these cups are filled with some level, some volume of blue ink, bear in mind that these two cups already have a level of black ink. And this black ink, we call them vulnerability. So these are the predisposing factors a child can have. It could be through genes or some kind of trauma the child has been through, some kind of genetic problem, or some birth injuries and things like that. The child is already predisposed, vulnerable for some mental disorder. And when the child faces some level of stress, both these cups, let's say they represent two different children, and both these cups are filled with the same level of blue ink, it spills in one, doesn't spill in the other. Now, if you actually look at the spillage, is actually due to the black ink, not the blue ink. Although we may blame the stress for our mental disorders many a times, it's also our vulnerability. All of us have different vulnerabilities. So it's important we understand the vulnerability. Of course, we have to deal with the stress as well, but dealing with the vulnerability is also far more important. So what are those factors influencing mental disorders? Again, depending on the child's age, gender, there are some specific disorders which are more specific in boys. We'll come to that in a minute, a lot of behavioral disorders. Depending on the age of the child, we may kind of look at what we are actually seeing. A young child through the developmental age, we may see a lot of behavioral and learning issues. In adolescent, we may see different set of problems. More serious mental illnesses could start emerging during their adolescent ages. So it's important to understand the age-specific and gender-specific causes. A lot of developmental aspects, like I said, as a child grows, there may be a lot of impairments in their different skills they acquire at different times and pace. So we need to be mindful about these aspects. Yes, genetics play a bigger role. Family history, any parental mental disorders or developmental issues can also make the child vulnerable. A lot of environmental triggers and factors could influence the child's mental disorders. Of course, the individual psychological factors, the personality traits, the coping mechanisms, the child's strengths, weakness, all those things do influence their resilience as well. And their own behavioral and lifestyle factors, which they may have developed over a period of time. Physical health aspects, like maybe let's say brain injury the child may have had during birth, or epilepsy, for example, or any other neurological disorders can also influence development of mental disorders. And of course, substance misuse, as they reach certain age, children may start experimenting with a lot of substances, drugs and things like that, which can have serious consequences on the mental health. Now, let's actually look at the mental health problems now. Just looking at the time. So, I want to just give you an idea about the manifestation categories without going too much into the categorical diagnosis and mental disorders, because what parents are usually concerned about is the manifestations. So there may be issues with developmental deficits, social deficits, for example, school-related issues, could be academics, could be child's concentration issues or peer relationships, or relationship with teachers, responding to stimulation, things like that. Behavioral issues we talked about, anxiety, mood issues, trauma, and lifestyle issues. So these are the manifestations which usually parents get concerned about. But when we actually look at the diagnostic categories, we broadly can divide them into developmental problems a child can have. I'll go into the specifics of them in a minute, and psychiatric problems. Many children may also have abuse and trauma-related problems as well. So as far as the developmental disorders of behavior is concerned, when a child is presented with a lot of behavioral difficulties, we need to at least be aware of some of the disorders the child could be having. You're all maybe aware about the attention deficit hyperactivity disorder, very common. So ADHD, we call it in short form. There are mainly three clusters of symptoms the child can present with: hyperactivity, impulsivity, and inattention. So hyperactivity is basically they constantly fidgety, moving around, very difficult for them to sit in one place. There's motor restlessness there. Impulsivity, they're very impulsive, they can't stand in queues, they're very impatient, they're very interruptive, they're very disruptive. Inattention, their attention span is very poor. Their ability to sustain attention for long is poor. The sitting tolerance is poor. They can't complete tasks and so on. So these symptoms usually should appear before 7 years of age and should be present in most situations, not just situational. It should be across the board and for over 6 months at least before you could diagnose. There's also this conduct disorder where a child can present with repetitive patterns of violations of basic rights of others and societal norms. Completely being very aggressive, irritable, argumentative, oppositional. A lot of cruelty could be there, particularly for animals. You see a lot of children being very cruel towards animals, and some children could present with even more serious problems like lying or theft and things like that, deceit and taunting and all that. So this little milder form of conduct disorder is the oppositional defiant disorder, where a child can present with pervasive patterns of negative, defiant, and hostile behavior. May not be violating the basic rights of others and social norms, but they do appear quite oppositional in nature. These behavioral disorders are quite common in boys than girls, and this is important for us to understand. If untreated, many a times parents, because of those issues we talked about, where they are not even aware and they may not do anything about it, may actually lead to a lot of personality disorders, problems when they grow up, behavioral problems, criminality, and serious mental illnesses, substance misuse, and so on. So there are other developmental disorders, we need to be aware, like tics and Tourette's disorder, where a child can present with persistent and repetitive, sudden, some twitches and motor movements. Some movements in the body. We call it motor tics. So they can have multiple motor tics and maybe some vocal tics as well. Motor tics example: a child could be having a repetitive eye blinking without any problems, facial grimacing, head jerking. The vocal tics can be throat clearing, sometimes grunting, making grunting noises like kind of thing, and sometimes even barking kind of sounds. They may not be in control. These are very involuntary. They can be very persistent, repetitive, and sudden as well. And usually can start very young, but can become severe around 8 to 11 years of age. And this association with obsessive compulsive disorder, a child can develop a lot of obsessions and compulsions when they grow up. So enuresis, involuntary urination, you all are aware, a lot of bedwetting and daytime urination as well. Usually, if it lasts beyond 5 to 7 years of age, they may need some medical intervention. Again, it's important to try and understand the underlying issues. Many times it could be quite organic or structural problem. Maybe they're having some urinary tract problems, infections, and things like that. So we rule that out first before we consider any functional problems. So encopresis, again, involuntary passing of stools. If it lasts beyond 4 years, parents should be concerned about. Again, like I said, we need to first rule out any physical or structural problems. So many children can also have pervasive developmental disorders. You may have heard about autism, autistic spectrum disorders, or Asperger's. So the main impairment will be in the social skills, even things like making good eye contact, the non-verbal behavior and communication will be very poor. Their ability to initiate relationships, form friendships, reciprocating socially or emotionally, and empathizing, all those areas could be severely impaired. And their ability to speak, develop the language skills. There will be a lot of delay in the language in terms of maybe comprehension, expression, and all that. And a lot of stereotypical behavior, and language also may involve a lot of stereotyping in them, and also lack of symbolic or imaginative play. They may have a very restricted interests and activities, very circumscribed rituals and behavior. Like they may be interested in, maybe wanting to play with the toy in certain ways only. If you, for example, if you give a doll to let's say a girl child, they may want to, play it like the child is a mother and, they are looking after a baby. But the children with autism, they may be interested in, let's say, the hair of the, doll, and may not be able to deal with the doll in whole. They may may be interested in the nail of the doll or hair of the doll and become quite obsessed about it. So a lot of children may also have a larger learning disorders. The language and specific learning disorders are global learning disorders of literacy. There may be an arrested or incomplete development of brain, and these are the areas the child can get affected. So it's not just about language and literacy. The social skills, the motor development could be impaired. The general intelligence could be quite low. So we do IQ assessment to understand the severity of the problem. Then we can actually plan the therapy and the future of the child. It could also lead to a lot of emotional and language issues. So we just briefly call it smiling. The child is not smiling. It's easy to remember. So these are the broad areas, when the child could get affected with developmental problems. Now, there are some psychiatric issues that we need to be aware, just very quickly. Anxiety-related problems, as you know, the anxiety could be manifesting in the form of psychological symptoms and physical symptoms. Psychologically, a little unlike adults, a child could present with a lot of irritability and aggression rather than fear and tension and preoccupations. There may be physical manifestations in a child as well, in some situations at least, like palpitations, sweaty, shaky, breathing difficulties, and all that. And again, children also present with a lot of somatic symptoms. Unlike adults, a lot of physical pains, pain abdomen, headache, and things like that. And they may usually refuse to go to schools if they have a lot of anxiety issues. So it's important we try and understand if it's situational or is it pervasive across all the board. And children may have a lot of avoidance behavior to specific anxiety-provoking situations, and they may develop even anticipatory anxiety. That is, even before they're actually in that situation, they may develop anxiety. So a lot of types, clinical types, like generalized anxiety disorders, specific phobias. Separation anxiety is very common in children, maybe in the age group of 7-8 years, which is unusual. Having a separation anxiety symptom at 2-year-old is normal, but someone at 7-8 years, when they separate from their attachment figure, like a primary caregiver, then they may develop a lot of anxiety symptoms. Post-traumatic stress disorder and obsessive compulsive disorder is also becoming very common. These days, I'm seeing a lot of children with OCD, not just the cleanliness and the contamination related OCD, but we also see a lot of unusual thoughts. Recently, I saw a young girl who had obsessive thoughts and images of her dad dying. Dad is perfectly fine, but she's getting this intrusive, repetitive, persistent image. She knows dad is fine. It's not a delusion, but she can't just get rid of those thoughts and causing significant distress and also affecting her academics. So children may have mood-related problems, just like adults. They may become very sad, losing interest in things, lack of energy, motivation, concentration, could significantly affect their sleep, appetite, weight. They may become quite irritable and quite fatigued as well. So including developing a lot of negative cognition about themselves, life, and feeling hopeless and worthless. Children very rare, can have bipolar disorder where they develop mania, hypomania, which is exactly opposite of depression, the other extreme of depression, where they actually become extremely values and irritable and related in their mood. This can happen with or without depressive episode. Like I said, it's a little rare. These are some of the symptoms of mania. Very rarely, children, particularly children with genetic vulnerability, which means when their parents have some kind of psychotic illness, they may develop hallucinations, which are false perceptions from any sensory stimulation, like hearing voices which are not there, seeing things which are not there, and even develop a lot of false beliefs or delusions. They may get into a lot of disordered and disjointed thinking, could affect their emotional state, cognitive state, and behavioral issues. Little rare, but it can happen. So self-harm and suicide, yes, it's quite common and increasingly becoming common as well in young children, particularly in adolescent. It's a fourth leading cause of death in over 10-year-olds actually. It's quite worrying. In fact, in the last 3 days, we've admitted 2 children of 14-year-old who had serious self-harm issues, and one even attempted hanging. Luckily, intervened by mother at 2:30 a.m. in the morning. So it's very concerning. The triggers could be a lot of children may attempt this as part of their very poor coping mechanisms, becoming very impulsive, or as part of their larger mood issues or negative feelings and cognition. The risk factors, if they are suffering from depression, if there's a family history of suicide, If they are using some kind of substances which could alter their thinking, poor relationships, traumas, life events can all be risk factors for suicides. So there are other psychiatric issues. Just for your awareness, children very common psychosomatic illness. A lot of times we see children having medically unexplained symptoms like headache, nausea, vomiting. You take them to several doctors, get several tests done, but everything is fine. But the child is still having a lot of physical symptoms. So the potential causes could be psychological distress, poor coping mechanism, maybe some environmental issues and stresses they're dealing with. Eating disorders quite common in adolescents. You may have heard about the term anorexia nervosa and bulimia. The difference is in anorexia nervosa, they are they get into a lot of self-induced weight loss with some body image disturbances. They feel they are fat, although they are very thin, and the body mass index can be pathologically low. They have a significant disturbance in the body image. Bulimia nervosa as well, where the child may engage in recurrent binging of food and purging with the lack of control and always preoccupied about their weight and shape. And child abuse is something all of us need to be aware. It could be happening just around us, in our neighborhood or within our own families. So this is one sensitive issue a lot of people may not even want to talk about. So, but friends, it's important that we all become aware and understand what constitutes child abuse. It need not be just physical. It can be sexual abuse, emotional abuse, or even neglecting the child of the basic needs of food and taking care of the daily needs could amount to abuse. So, what are those alerting signs that child abuse could be going on? Is we see unexplained injuries on the child, we see the child becoming more fearful, little aggressive as well, refusal to discuss or treat injuries, child may refuse any treatment, becoming very withdrawn, sometimes sexualized behavior. I've seen quite a few children who have been through sexual abuse themselves develop sexualized behavior themselves. They actually develop sexualized behavior, become more interested in watching sexual videos, maybe getting into talking about sexual matters. And if you dig deep into what's happened to the child, they may have been the victims of abuse themselves. Self-harm, psychosomatic symptoms we just talked about, poor peer relationships, sometimes eating disorders, recurrent infections and pain. So all these things could be warning signs of a child potentially going through some kind of abuse. So adolescence is something we all need to be aware because it's a unique phase of life. It presents with unique opportunities and unique challenges as well. So here the child is not actually a child, neither an adult. So there is that transition the child is going through. It's a new social phenomena, adolescence, because nowadays what we see is a physical and sexual maturity happening much earlier than the child attains that adult role. Unlike few centuries ago, maybe now the children are still in college and schools. They're not ready to take up that adult role, but they may all be going through that physical and sexual changes because of all the hormonal changes in the body. So that's when the child develops a new identity for themselves, where they start to see they are independent, they can exert their independence and develop that autonomy, which could lead to conflict with authority. This is where the parents need to be a little sensitized about the child development because the parent continues to see the child as a child, their own baby. Yes, the child is still their baby, but you need to understand the child is almost becoming an adult in their thinking. They have their own independent thinking now, and they want to exert their independence. They know what is right, they know what is wrong. So they may have their own perception. So it needs to be acknowledged and appreciated. However, like I said, as much as opportunities it may provide the child to develop that independence and and autonomy for develop that resilience, it also is a very vulnerable phase for children to develop mental disorders, particularly eating disorders, mood disorders, substance misuse, self-harm, and things like that. So there are a lot of lifestyle behavior and substance use that many parents may get concerned about. So we need to at least be aware that a child could be going through some of these factors like peer pressure. Maybe they're developing curiosity of certain behavior, like if they see some of their friends and peers like smoking or drinking, they may also want to try and see how it feels. Experimentation could lead to substance use. Maybe sometimes as a self-medication, like when they're going through stress, they feel that it numbs their emotion. Copycat behavior, they may see some role models on the TV or somewhere, drinking or smoking, and they may want to do themselves. Adventure and risk-taking behavior, can also develop in adolescence. So these are the factors which may lead to a lot of behavioral difficulties, lifestyle, and substance use in adolescents. So getting help, just a couple of slides about what to do when you notice some of these changes in a child, behaviorally, emotionally, socially, cognitively, interpersonally, academically, and things like that. So we need to have our own behavior management strategies. You don't have to run to a psychiatrist or a psychologist. Many times you can find your own solutions. Take a step back, just discuss in the family in terms of how can this be addressed. Take a problem-solving approach. Many minor things can be resolved at home. Sometimes you may want to consult your family doctor just to make sure that you're not missing anything here in the child's development and mental health issues. Maybe discuss with the child, the school teachers, and understand what's happening at school. Sometimes, yes, you may need to take professional help and a coordinated approach with the healthcare professionals. So when to seek help? If you notice the pattern, any particular pattern we just spoke about, all the mental disorders and manifestations, look at the course and the nature. If it happens just maybe once in a while, maybe you don't need to get concerned. But if it happens repeatedly, frequently, again, the duration and the frequency, severity is important. And lastly, impact. If it's causing some impact on their academic behavior or general social behavior, the way they're managing relationships, the way they're managing their lifestyle, then you need to be concerned. Or the risk. If they are posing some kind of risk to self or others of some kind, that's when you definitely need to take a professional help immediately. So what we know so far is understanding the changes in emotions, behavior, cognition, learning, and social deficits of children. Now you can use that knowledge to make sense of any particular change you may notice in your children. Early identification and intervention can prevent significant damage. Collaborating with family members, teachers, and doctors is very important. Using basic interventional techniques to manage is all that you need to sort out issues. Yes, some children may need professional help, particularly if they're posing high risk. And amongst all these, do not forget to be mindful of your own mental health. End of the day, as parents, you are also human beings. You have your own emotions, your own perceptions, your own stresses to deal with. So just to be a little mindful, take a step back and understand whether your own kind of way of thinking and being is affecting the child. And of course, you need to take care of your own mental health as well. So many times, even if you don't remember any of the things we spoke about, sometimes there's always this gut feeling that you can just tell that something is not right with the child, right? So don't ignore it. Try and explore it a little deeper. Maybe speak to an expert or speak to the doctor and understand a little more before it's too late. So children can have mental health issues too. That's the message I wanted to convey. It's about understanding, accepting, and managing it. Of course, when we do that, we can definitely make every childhood beautiful. And moving on to Dr. Tulika Shukla, I just want to set the stage. If there is anything we wish to change in the child, we should first examine it and see whether it is not something that could better be changed in ourselves. I think that's where Dr. Tulika's talk would be very useful, talking about positive and protective parenting. So thank you very much for patient listening. I'll just hand over to Dr. Tulika Shukla now and wait for the Q&As at the end of our talk. Thank you.
Thank you so much, Dr. Satish, for the insightful presentation.
Just stop sharing.
So very warm welcome, Dr. Tulika.
Hello.
Yeah, hello, doctor. How are you?
So it was a very insightful talk by Dr. Satish, and very broadly he has covered almost all childhood-related issues that can present in children. That can present, and that parents need to be aware of. If we are good to go, Japneet, I can start with my presentation.
Yes, please carry on.
Okay, sure. So, following this presentation, I would like to take the theme forward and talk about parenting issues and how we can, instead of being reactive parents, become proactive and positive parents. Let me start my share screen. Yes, so I think everybody can see.
Yes, doctor.
Okay, so today's topic, I would be talking about positive and proactive parenting. I'm Dr. Tulika Shukla. I'm MD Psychiatry, and I have currently working as a specialist psychiatrist at Millennium Medical Center, Dubai. Starting off, so first of all, like already mentioned, parenting is one of the toughest and most fulfilling jobs in the world. People can have different goals of parenting. For example, so it's a very personal thing. How do you want to raise your children? But what most parents say is that they want their children to be independent, they want them to be happy, they want them to be self-sufficient, responsible, successful. But if you want to have a basic goal of parenting in mind, it should be to help your child or help or guide your child to become the best version of themselves. If you keep that in mind whenever you are, whenever you are in a place that how should I be handling this situation, this can be deciding, you can say like a mantra that, whatever, I just want my child to become the best version of themselves, and whatever decisions I make should be based on this. But despite that, we are continuously second guessing ourselves, whether what we are doing is right for our child, whether this is okay, whether I should use a different approach. And there's a lot of parenting advice available. Yeah, there are more than, there are way too many books available on parenting, and you don't know which ones to follow, what are credible sources where you should go, and this just makes things even more complicated. So before we go into what is positive and proactive parenting, I would like to address some of the wrong notions that parents might have about what parenting is all about. Well, people think that I should be instinctively good at parenting. Now that I've had a child, I should exactly know what I should be doing with my child. Well, no, not exactly. Parenting is a skill. Just like all other, like for example, teaching is a skill. For example, being a doctor is a skill. Similarly, being parenting is also a skill, and we can all learn to be better. You are either a good parent or a bad parent. The truth is that there is a normal range of parenting behaviors, and most parents, they lie on a spectrum. So some parents are, there are some behaviors which can be considered very good. There are some behaviors which could be considered bad, but then most of the behaviors are in the middle, and we can always use different strategies and learn appropriate parenting behaviors. There is a right way of parenting, that this is the way parenting should be done. And if you are not doing this, you are doing it wrong. And that is where helpful advice from people around you becomes problematic, because there is no right and wrong parenting. What child psychology says is that there is something called as goodness of fit parenting. According to the child's needs, according to the child's temperament, according to the child's developmental stage, you have to change your parenting practices. Lastly, now that I'm a parent, all my time should be devoted to my child. If you are feeling burnt out, if you're feeling exhausted, taking time off from your parenting responsibilities becomes essential, because then you'll not even be able to do that job properly. It will start affecting your mental health. So knowing that you are feeling burnt out is also very important. And instead of feeling guilty about it, that see, I'm feeling guilty about it, it is better to take a break, to address the burnout, and then come back to your responsibilities. Another thing is that parents, I have seen in my practice so many times, that if a child has a problematic behavior or the child is behaving in the wrong manner, they think they are a bad parent and they feel ashamed of that behavior. Well, bad and wrong behavior needs to be understood and it needs to be corrected. It does not mean that the parent has failed or the child has failed. It simply means that there is a problem and we need to address it. So a lot of times, instead of getting defensive about a problematic behavior, it is, or being in denial, that Dr. Satish talked about, that a lot of time people are stigmatized and they are in denial that, my child has a problem. You first of all address it, accept it, and then look for a solution for it. So what is positive and proactive parenting? Well, positive means that the experience of parenting can be an extremely positive experience, an enjoyable and a fruitful experience for both the kid and the parent. If it is becoming too stressful, that, in the attempt of making your children a better person, the process is becoming very tedious, it's becoming a very stressful experience for both the child and the parent, then probably we need to reassess how we are doing it. And one of the most important principle here would be that if you base your parenting on communication and mutual respect rather than on obedience, you will get better results. Lastly, what is proactive parenting? So proactive parenting is, again, that if you know that this is the child's developmental stage, you know this is their temperament, and you know what they need at every stage. Sir spoke about the Maslow's hierarchy of needs. So if you take care of these things, if you take care of their needs in a proactive manner, use strategies which are in tune with their temperament and according to their developmental stage, you will get much better results. So before I go into specific tips of what we should do and what we shouldn't do, I would like to explain a few concepts of psychology. If this is too technical, you don't need to understand everything. You just need to understand how do you use it in your own family, how do you use it with your own children. So firstly, if you look at the different domains of development, we all talk about the fine motor and the gross motor, cognitive, language development, and social and emotional development also. There are also the spiritual and moral domain of development, and also the adaptive domain of development. If you want to understand whether your child is at par with all in terms of their developmental milestones, and you think that your child is not picking up things just like other kids and there might be an issue, I advise you to go to this particular link. The CDC has they also have a milestone tracker, and you can see whether your child is up to date on different milestones or not. If they are not, then I would definitely suggest you to meet a child psychiatrist or a neurologist, depending upon the areas of delay. So in case of your cognitive and the motor developments, you can definitely go to this website. When you're teaching about behavior, I would like to specifically talk about stages of moral development and how do you apply it to your parenting. So you have to understand that moral development is in parallel to their cognitive development. The way they understand the world, the same way they understand morality also. So pre-conventional stage of morality is seen in children less than 7 years, where good and bad is decided by whether the behavior is rewarded or it is punished. As simple as that. So if I do a good thing is that which everybody is appreciating and giving me a reward for, and bad behavior or bad things are those which are getting punished. So if they see a particular behavior being rewarded or a particular behavior being punished, they will decide it to be good or bad. A little older, when they reach the 7 to 11 years of age, they start understanding that social approval of a particular behavior is what makes it a good or a bad behavior. So for example, to explain pre-conventional and conventional, if there is a cookie, the guests are there and there's a cookie on the table, a 3-year-old child will come and they will take the cookie because it's a good thing and they will eat it. An 8-year-old child will be mindful of the fact that there are guests sitting. If I will take it in front of everybody without asking, people will think I'm a bad boy. So the good boy, bad boy kind of an approach is there, that things that will make me look good, I should do those things. It is only after 11 years of age do children develop this ability to have a right-based approach or an ethics-based approach, that, this might not be approved by social norms, but then this I think is right. So that understanding starts at the age of 11. Having said that, there are, it is not necessary that a 12-year-old will have that understanding. But before 11, they don't have the cognitive capability to have that kind of an understanding. So how is this relevant to your parenting? This is important because if you are going to reinforce certain behaviors, if you're going to encourage them to do good behaviors, you have to do it at the level that they will understand. So till 6 years, 7 years of age, you have to reward good behavior. You cannot accept that, they will learn by giving them principles of ethics. So if you explain to a 6-year-old why they should not beat other people, it has to be told that this is bad, so you cannot do this. And this will lead to punishment. So your strategies would be to give them something like a timeout. instead of giving them a lecture. Okay, that was first thing that I wanted to explain about how do you understand, how do you explain things to children, and good and bad to children. The other thing is that you need to be very mindful of the temperament of your child. If we are talking about goodness of fit parenting, so Thomas and Chess were a group of psychologists who gave 3 temperaments, who observed children for a very long time from their infancy to an older age, and they came up with 3 groups of temperaments where they could classify children. They said that in their study, they found that almost 40% children were easy children. They were very happy, active children from birth, and they adapted very quickly to new surroundings and to new environments and to new situations. The other group was the slow to warm up children. Initially, they were less active. They were very mellow from birth. They had a tough time. If you change their situation, they would have a really tough time. But then gradually they would adjust to the new place. But initial adjustment would take time. The third group, which was labeled difficult children, were labeled difficult because they were difficult for the parents. Otherwise, it's not that they are bad children. It's just that they have irregular habits and they have a little irregular biological routine. They will sleep a little, so you will not be able to set a routine for them. Their routines will get disrupted very easily. A little bit of, evening you party too much one day and then next whole week their sleep cycle is disturbed. Similarly, their eating and sleeping is not very regular. They also have a lot of difficulty adjusting to new situations. And in addition to that, they also express negative moods very intensely. So this is something that you can pick up as soon as, 1 month or 2 months of your baby, that what is the temperament of my child? And once you know this is the way the child's temperament is. Now, once you know this, you can adapt your parenting styles in the future to this. The next one, around 35% of children were a mixed bag. They had all the traits of different 2 categories together. Right. So how did Thomas and Chess classify these children? They looked at 9 dimensions of their temperament. So I have a little detailed understanding. If you want to understand how to assess the temperament of your child, there are different temperamental qualities depending on their activity level, their rhythmicity, how regular they are in their routine, their distractibility, whether when they are upset or whether when they need something, are you able to distract them? Whether approach and withdrawal, when a new thing is given to them, do they approach it or do they withdraw from it? Lastly, then there is the adaptability, whether when you are giving them a new stimuli, when you're putting them in a new situation, do they adapt easily to it or they don't adapt to it, they don't like being disrupted. Attention span, whether they have a long attention span or whether they have a short attention span. Intensity of reactions, again, whether it is intense or mild. What is their threshold of responsiveness, whether they respond very easily when they are approached, stop sucking on the bottle when approached, whereas high is not startled by loud noises. Similarly, the quality of their mood, do they overall have a positive mood or do they have a negative quality of mood most of the time? Understanding this will help you understand. This is not to classify children as good or bad. This is just to understand your child and accordingly use your parenting strategies. That is what is goodness of fit parenting. So when you understand your child's temperament, you can plan ahead to prevent problems. And this is what is called being proactive. This means that rather than just reacting to your child's behavior, you can plan and anticipate what your child may need. And you can also prepare for what kind of problems you are going to face and accordingly use the strategies. For example, if you know that your child has slow to warm up temperament, you will like to introduce foods a number of times before the child will take it up. So if you're introducing food, like you're moving from breastfeeding, you're moving to solid food, and you introduce food to child and the child spits it. You know that my child takes time to adapt to new things. So you'll have to give it a few more tries before the child accepts that, okay, chalo, I will take this. In case of a difficult child, you will have to keep testing and knowing which things does the child like, because they will be fussy about it. They will take only things that they like. Similarly, if you have a very active toddler and you know that, they need to jump, they have a lot of energy and they need to jump and they have to, so you have to make sure that if you want them not to create a chaos in the house, they need that time out in the park. They need to jump around and play around in order to be quiet in the house. Right. So if now that we have understood about the child's temperament and how do you use your parenting strategies according to the child's temperament, it is important to understand how do we reinforce. So what is reinforcement, first of all? Reinforcement basically means that you know that there is a certain behaviors that you want your child to do more. And there are certain behaviors that you don't want your child to do more. You have to use reinforcement and punishment in a way that the positive behaviors or the behaviors that you want are increased, whereas the behaviors that you don't want are decreased. How do we do that? How do we do that? So there are two terms that are important here. One is reinforcement and the other one is punishment. Positive reinforcement is basically, so I'll explain with examples instead of explaining this chart to you. Positive, I'll briefly tell you what it means. So positive reinforcement would mean that you give a good thing to the child. You reward the child with something that they like. Negative punishment, negative reinforcement would mean that you take away something from the child which the child likes, which the child does not like. For example, they don't like to do something which they are supposed to do every day. You take that task away from them. So it is pleasant for them that, okay, I hate to do this particular thing and you took it away from me, I'm happy. So that is negative reinforcement. It is also, so you have taken away a negative experience from them, and that will, whatever you are using it as a reward for, whatever you are using it to reinforce will get, so ultimately reinforcements will increase the behaviors that you want. Punishments. Positive punishment is when you do something bad to the child in order to weaken a particular behavior. So if the child is touching the switch, you smack the child's hand. That is positive punishment. Coming to negative punishment is that something good is there with the child and you took it away. So if the child has behaved badly, you take away their doll that they like. You shouldn't do that, but then that's what negative punishment means. I'll give you some examples. Positive reinforcement is like smiling at the child, appreciating the child, giving them a new toy, giving them a toffee. When they get good grades, that all these are positive reinforcements. Negative reinforcements are that you don't have to do a house chore today. You don't have to do your homework today. So these would be negative reinforcements. Positive punishment would be, again, writing lines, a slap, fines, it could be paying fines because you delivered your, you didn't submit your book in the library on time, you have to pay a fine. These are all positive punishments. So negative punishment is you take away the phone privileges, that okay, you behaved very badly today, you will not get to use your phone for the next 4 days. Similarly, a timeout that is given to children. When they behave badly, they are told that you need to go and sit in the corner till you understand what you have done. So these are examples of negative punishment. Right. So coming to primary reinforcers and secondary reinforcers. So what things can you use as reinforcements and punishments? Primary reinforcers are things that are biologically reinforcing. For example, food, water. So basically all the things that are on Maslow's hierarchies of, basic physiological needs. Food, water, sleep, safety, temperature, and comfort. Now, if there is any act, so if you want to understand if a child is not doing a particular thing despite reinforcements and everything, you have to make sure that one of these factors are not at play. For example, the child does not want to go to school. There is school refusal. It is quite possible that the child might not be feeling safe in school. There's somebody in school who is kind of not treating the child well, or they're being bullied over there. And then if they're not feeling safe over there, they will have school refusal, despite liking to study, despite liking people, despite all of those things. So anytime a problem behavior occurs, you need to realize, you need to kind of break that incidence down and see what kind of reinforcements are at play here. Coming to the secondary reinforcers. Secondary reinforcers here are the ones that you learn by association. For example, appreciation, good grades, money. These are not actually reinforcing in themselves, but you know that you know by association, you have learned over time that these things are good things. So attention, appreciation, all these things are secondary reinforcers. As the child becomes older, it is basically said that you should use secondary reinforcers rather than using primary reinforcers when you're trying to encourage a behavior. Coming to what are the characteristics of reinforcements and punishments. So it is important to understand that immediate rewards. So if the child has done something and immediately there is a consequence, the behavior happens and the consequence is immediately after that, the learning will happen faster. That, okay, every time I do this, I get this punishment, or every time I do this, I get this reward. The learning will happen faster. So if the child has a unit test and the child has studied and they get good marks, and the next day itself the teacher reads out that, okay, this child has got good marks in class, these are the results. Or even if they don't read out the marks in class, if they tell you that, okay, you have done well, it is an immediate reinforcer rather than the child coming to know at the end of the year that they have done well. The other one is use natural consequences. For example, if the child has forgotten to take their lunch to school, they forget to take their lunch to school repeatedly, you are always correcting them and you are always giving their tiffin to them in their hand and they keep forgetting. Now, if you use a natural consequence here, that if they don't take the tiffin, they will have to go hungry. It's a natural consequence, which is not going to harm them in a very serious way. I mean, don't do something that will, don't go overboard and make sure that they're safe, is what I'm saying. But natural consequences which are happening. So every time, don't correct them. If they are doing something, that, this is something they need to learn. So for example, I mean, I'll give my own example. When I was a young kid, I would, just I'll come back from school and I'll keep my school things here and there. And next day morning, my mother will be searching it for me. And she would generally arrange it for me. And then later, I realized that if I don't do it on time, so after that, she stopped doing it. So then I realized that if I don't do it myself on time or day before, next day I'm going to miss my bus and there's going to be a problem and I will not end up going to school. So 1 or 2 days I suffered, but then I learned my lesson. So use natural consequences, let them suffer a little so that they will understand on their own. Don't do everything for them. Then comes logically related to the behavior. Now, if you suppose you're trying to use reinforcements, you're trying to use punishments, let them be logically related to the behavior that they are doing. For example, if they are not going to, for example, if they don't grease if they have to maintain their bicycle, if they have a bicycle and they don't maintain their bicycle, you tell them that because you have not maintained your bicycle, you will not get to use it for the next 1 week. And once after 1 week, you get it kind of repaired and then only you can use it. You kind of get it serviced and then only you can use it. So that's sort of logically related to whatever is that you're trying to inculcate in them. Lastly, the magnitude of the reward that is being used. So for example, for a small task, you should give a smaller reward, but for a bigger task, you should use a bigger reward. Same for punishment also. So if you're depending upon the kind of behavior you're trying to, if it is something very serious, for example, death penalty has been reserved for very serious and heinous crimes. So the magnitude of the crime is so big, and that accordingly the punishment has been kept so large, because because the punishment is so large, it really takes away the risk of going ahead and doing that activity. It acts as a good deterrent. So these are the kind of things you should use when you're deciding how you should reinforce certain behaviors in your children. Another way that children learn. So one thing is that you use the correct reinforcements. You use these reinforcements consistently in your child, and they will learn the right and the wrong over time. Another very important way by which children learn things is social learning. So learning does not only happen through reinforcement, but also through observation. And the children are observing multiple things every day. But how is it decided that they will acquire the observed behavior? I have so many parents who come and tell that he has started speaking like this one character that they watch on a particular show, and they have started speaking like that, and the child continuously, nobody else speaks like that, he or she continuously speaks like that. What do we do about it? Well, so in order to learn any social behavior, there are 4 things that should happen. First of all, the child has to pay attention to that behavior. So now you know that, because although everybody else is speaking normally, it is that particular thing that the child is watching so attentively, they are paying more attention to it, firstly. Secondly, the other thing is retention. So basically, if the child is able to remember it, and if the child, whatever they have seen or heard, they were more likely to repeat it. When we talk about retention, here is where it comes that, how many times the child is being exposed to that behavior. If the child is seeing it every day, if the child is seeing it multiple times in a day, they are going to retain that behavior. Lastly, reproduce the behavior. So if the child is given an opportunity to reproduce and they have the physical capability to reproduce the behavior, they will start doing it without anybody actually teaching them or giving them instructions. The most common thing you must have noticed is that children are given toys to play, but they still prefer to play with mobile phones and remote controls, because they have seen adults use it day in and day out from the time when they were not even able to hold the phone themselves. They have constantly seen that, parents take the phone and they do like this. They don't know what it does, but they will imitate that behavior. Lastly is the motivation. They will imitate these behaviors, but then if they don't find any benefit in doing it, if they don't find it enjoyable, if they don't find it serving any purpose, they will stop doing it over a period of time. Right. Last psychological concept that I would like to discuss is in terms of misbehavior. We have talked in depth about how do we promote good behaviors and reinforcements and all of those things. It is important to understand, why do children misbehave? So there are 4 goals that children have in mind when they are misbehaving. One is to gain attention. In a child's world, negative attention is better than no attention. So if they are not getting attention, they will do bad behavior in order to just get your attention. The second thing is to gain power and control. So if the child does not feel powerful, does not feel autonomy, and they feel that they do not have power, in fact, they feel weak, that they don't have any control, they will try to exercise their power on somebody that is not on whom they can. So for example, they cannot exercise power at home, then they will go and exercise power on somebody in their class. So if this sort of behavior is emerging, if it becomes like a power struggle, that is where the parents have to realize that they have to, I'll talk about what do you do in such a situation later. But third is to gain revenge. Revenge is basically when the person has felt, or the child has felt frustrated with something, or they have felt disappointed with something, and they direct that anger to taking revenge. So if you look at it, and lastly, it is to display the feelings of inadequacy. So if they feel inadequate, they have already given up on themselves that this I'm not going to be able to do. So they don't do it at all. They don't even make an attempt. So like I discussed, what do you do? How do you handle these misbehaviors? So if the child is doing it to gain attention, you have to ignore the behavior. Secondly, you can distract the child. These are 2 basic strategies, and reinforce the other positive behaviors that the child is doing. So if they start getting attention for the positive behaviors, the negative behaviors will in time get diminished. Second is to give, when they are doing it to gain power and control, do not get into the power battle, because that makes them feel that, yes, I do have this can be a way I can get power. So if you don't engage in the battle itself, the child will step down. And secondly, focus on their positive behaviors. Third, when they're doing it to gain revenge, it is basically what they are actually seeking is a sense of belonging. So provide that in a positive manner rather than treating this as a problem that, the child is being vindictive. Lastly, when they're displaying feelings of inadequacy, you will have to gradually, systematically encourage them to do those tasks. Make them feel that that even small achievements are very important. If they are not able to complete the task completely, break it down into smaller parts, make them feel that they can master smaller steps at every time, and then gradually they will gain confidence and they will be able to complete their task. So after understanding so many concepts of psychology, how do you actually put it into practice? They are very nice when you read it in a book. Doing it at home it's a lot of effort. So let's understand, how do you practically do these things? Well, the first thing is that successful parents, they have healthy home atmospheres. So basically, if you are a stable married couple, you set a good example for your child. Having said that, single parent homes are also equally capable of providing a loving atmosphere for their child, although they might have more challenges than families where co-parents are there. Overall, if the child's need for security, stability, and affection are met, the child will thrive. Coming to disciplining, you have to set limits. So like I said, in the initial 7 to 8 years of their life, they only understand good and bad by reward and punishment. So you have to set limits. The disciplining is very necessary in every household. The goal of disciplining is to choose acceptable, so that you can teach them how to choose acceptable behaviors, and so that they learn self-control. Some rules can be no television until homework is done, no name calling, no teasing. And if you do these behaviors, there will be consequences. So have a system in place. For example, the first time you do it, you will get a warning. The second time you do it, you will have a timeout or a loss of privileges. Be consistent and follow through with the consequences. This is very important, that if today the child has done something and you have taken away the phone, and you have kind of taken away their phone privilege, and the next time they do the same behavior, you don't follow it up with similar consequence, learning will not happen. In fact, that will accelerate, or that will actually increase those behaviors, because the child will be, I may get punished, I may not get punished, let me try it. So consistency is very important for learning to happen. Consistency of consequences is very important. Lastly, using natural consequences. I have already discussed about using natural consequences and using consequences that are direct and logically related to the situation. This will all help your child make better association between the behavior and the consequence. So let's take, for example, if your child is testing you through a temper tantrum and they are behaving disrespectfully, you can ask them to leave the room, or tell them that you will be in the next room and we can try again later when you are calm. Then disciplining should never be motivated. This is very important, that the disciplining should never be motivated by anger, pride, or anxiety, as this will cause more harm than good. Instead, you should always remember, you should always keep a check. I know nobody does it purposely. Nobody says that, I'm going to express my anger on my children. It should be, but it's not very easy. So whenever you feel that, you always keep a check on your parenting behaviors, that whatever I'm doing, is it motivated out of anger? Is it actually the best way to teach my child this particular thing? Or is it motivated by love and a desire for your kids to become the best version of themselves? So basically, parents generally have this issue, am I being too harsh with my child, or am I being too lenient with my child? So a good way of deciding it is questioning why you're doing it and understand your own motives behind your parenting behaviors. Lastly, boost your child's self-esteem. I think this is something that I cannot highlight enough, but most of the time we see that we are criticizing our children for all the bad things that they're doing. You are watching too much phone, you are watching too much TV. Just imagine, how would you feel if your own boss did that to you, if they were constantly pointing out all the wrong things you were doing and never pointed out all the right things you were doing? You will feel misunderstood, you will feel cornered. and you will not feel like doing whatever good you were doing, that no matter what I do, ultimately I get criticism only. So let me stop doing good behaviors altogether. So it's very important that you catch your children being good, because children develop their self-esteem through their parents' eyes. And the words you use, the tone of your voice, the body language, your expressions, these are all absorbed by the kids. So if you, and another thing is that if you want to criticize a particular behavior, don't say that your behavior, you are a misbehaved child. Say your behavior was not good. This particular behavior was not good. Instead of labeling the child that you always do like this, or this is the way you always behave. You, instead of labeling the child, label the behavior that you're criticizing. Finally, make it a point to praise your children for every day, but keep the praise genuine. Catch your kids doing something right or doing something good. Be generous with your rewards. So child psychology basically says that rewards work better than punishments. And if you are encouraging positive behaviors over a period of time, the positive behaviors will keep on increasing and you will have less negative behaviors to criticize. Like I said, children learn a lot by observing. So you need to be a role model. Young kids learn a lot by seeing how you act. So if you are angry and you lash out in front of your child, is that what you want your child to learn? That next time when they are angry, they should also lash out. So you need to be very mindful of the fact how you are also interacting with other people in your child's presence. So a lot of studies have also shown that, children who hit other children have a model of aggression at home. So whatever traits you want to inculcate in your child, do them in front of your child. For example, respecting other people, friendliness, honesty, kindness, tolerance. Build these behaviors, do them specifically in front of your child in order for them to see it and inculcate the same behaviors. Next, communication is a very important thing that a lot of parents have this understanding that whatever we are saying, the child should obey. Obedience seems to be what parents are most of the time thinking that, this is a good thing. I'm just telling the child to do a good thing. And the child should follow it. It might not be that simple for the child. So you can't expect kids to do everything simply because you as a parent say so. Make your expectations clear and explain why you expect that. If there is a problem, discuss it, express your feelings, invite them to come up with a solution together. Be sure to include the consequences, whatever suggestions, and make suggestions and offer choices and alternatives to that particular thing. And be open to your child's suggestions. Negotiate with the child. So for example, if there is a child and your child hates milk, instead of forcing the child to, beating the child that no, you have to drink your milk, it is important for your bones and all of these things, ask the child, why do you hate milk? What is the problem with it? They'll say, I don't like the taste, or I don't like the smell or something. Then you can discuss, would you prefer to take curd instead? Or some other milk product like cottage cheese or some other milk product which will give you enough calcium. My agenda is I want to give you calcium. So tell me what alternatives I can have so that it stops being a power struggle. Similarly, so definitely, so you can have suggestions and you can negotiate with the solution. Lastly, kids who participate in a particular decision are also more motivated to carry them out. So if you discuss something with your child and you come up with a solution, the child is more likely to follow it through. Lastly, it is very important to adjust your parenting style. So a lot of times I have seen that parents are very let down by their child's behavior. And a lot of times it is the parents' expectations that need to be addressed rather than the child's behavior per se. So in this case, I think it would be helpful to talk to somebody about, what parenting behaviors are you doing and what is the motives behind your parenting behaviors. The parenting style that can work for a 5-year-old will definitely not work for a 15-year-old, right? So you have to adapt. Like, for example, so the most important thing to understand about teenagers is that they look at their peer group for modeling behaviors. They look at what the peers are doing rather than what their parents are doing. Because They are forming their own social networks, they're forming their own social circles, and what their friends and their people their age are doing seems to be more important than what they see. Their younger children, they will follow what their parents are doing, like 2-year-old, 3-year-old children. Older teens, they will start doing whatever they're seeing peers doing. So in that case, you have to give them that autonomy. You have to let them, behave the way they want to behave. But at the same time, you have to provide guidance. You have to encourage, and you have to give them the appropriate direction along with giving them a little more independence. Lastly, understands the child's temperament. So expecting that an introvert child should become a stage performer or an extroverted child should sit in one place quietly and study. This is a mismatch of technique and temperament again. Lastly, you all need, all parents need to understand that you are an imperfect parent. Nobody is a perfect parent. It is a skill. We can all improve our parenting. Most important is what is your intent and goal. What goal? So the goal is also very important. What exactly are you aspiring for? Getting parenting guidance when things get tough is another useful strategy. Admitting when you're burnt out, taking time out to do things as a couple or as a person does not make you a bad parent. Focusing on your needs is not selfish. And it simply means that you care about your own well-being. And it is also a very important thing that your children need to model from you. Lastly, ask for professional help. If you're finding difficulty in parenting, it is always useful to get evaluated by a child and adolescent psychiatrist. Rule out conditions like autism, ADHD, IDD, ODD, learning disorders, because a lot of time you might be using neurotypical strategies, strategies which are applicable on neurotypical children, and your child might have an undiagnosed neurodevelopmental or psychiatric issue. Another issue might be that there are unaddressed marital issues, there is burnout, there are anxiety disorders or personality issues in the parents, and these are causing a problem. So there can be an undiagnosed condition in the parent, there can be an undiagnosed issue between the parents, there can be a undiagnosed issue in the child, or there can be a mismatch of temperaments and the temperament and the parenting techniques. So all of this, if there is a serious issue that you're really finding parenting to be very stressful, it is always good to get an assessment and get professional help and parenting guidance. So lastly, take home points, just a revision of everything that we've just talked about. Understand your child's temperament, understand your child's developmental stages, use communication, environmental and reinforcement techniques accordingly. Disciplining and structure is essential, and you need to be consistent. Children are like sponges. They observe and internalize the behavior that they see. Be mindful of what they are observing. There is no such thing as perfect parents. There is no right and wrong parenting. There is a range of normal healthy parenting behaviors, and most parents lie in this range. There are a few things that are a definite no-no, like for example, humiliating the child or using physical punishment, or anything that puts the child at harm is a definite no-no when it comes to parenting. But most of the time when we are scolding the child or we are yelling at the child, these are all normal parenting behaviors. So don't overthink it that, okay, I yelled on my child, did I do the right thing? Lastly, like I said, parenting is a skill. We can all improve our parenting. And most important thing is the intent and the goal. And keep a check on your parenting behaviors, that they are not driven from your own self-esteem needs or your anxieties. The goal of parenting is to raise independent and emotionally stable adults. And lastly, to help them become the best version of themselves. So if you want to get more positive parenting tips across ages, so depending on the specific problems that happen in every age group, you can go to the CDC website, and there is a link here where you can go and you can get specific age-wise problems. Every age, these are the problems, these are the problems. I have gone through an overview. They have given it for everybody. Like you can see for different age groups, they have given separately. So lastly, parenting is a transformative journey. And as the child achieves milestones, so does the parent. So we have tried to discuss in brief about the basic principles of positive and proactive parenting.